I really wanted to thank Aggie for the opportunity of coming out here and speaking to the group. And so with that, I'm going to start and focus in on the importance of family history of pancreatic cancer. So keep in mind, cancer is a common disease. About 1 in 3 people will develop cancer in a lifetime. That doesn't mean they're going to die of it, but will develop it. And putting it in context, about 1% lifetime chance of developing pancreatic cancer. So it's a rare cancer. The incidence is going up though. There's going to be almost 42,500 cases anticipated this year or last year, and about worldwide over 200,000 cases. It is, even though it's a relatively rare cancer, it is still responsible for the 4th leading cause of cancer death in the United States. So smoking is it is the most significant and reproducible and viable environmental risk factor for pancreatic cancer. It increases your risk 2 to 3-fold. And if you happen to have a familial risk, it actually doubles that risk. So you don't want to get into the doubling game. So what is genetics? That's the branch of biology that studies hereditary and variation in organisms. It's how traits are passed down through families and why we're all different in this room. So it's common for us to all have mistakes in our DNA. And we live with that, and most of the time it doesn't matter. But occasionally we do get these genes that can put you at an increased risk for diseases, and obviously the ones we're interested in are the ones that put you at increased risk for pancreatic cancer. So let's start getting into some of those questions with this background, and the first one is, am I at risk for getting pancreatic cancer if a loved one has pancreatic cancer? If they have one 1st-degree relative out of these families now, so there's about a 5-fold risk of getting pancreatic cancer prospectively, so when they followed them. If they have 2 1st-degree relatives, the risk is quite similar, 6-fold. But when you start getting to more and more pancreatic cancer, then there's probably more of these genetic factors that are stronger, then you're getting to about a 32-fold risk. This is just a list, I know it's overwhelming, of different syndromes associated with pancreatic cancer. Hereditary pancreatitis is really the only known genetic syndrome associated with pancreatic cancer, where the only cancer type that you're at risk for is pancreatic cancer. And that's because it's a really bad inflammatory state of the pancreas where they get pancreatitis. And because of that inflammatory state, that puts them at risk for developing cancer. To answer the question on genetic testing, you have to look at the pedigree to make an educated decision. And that's the only way we do it. We just don't randomly go ordering it on patients who come in. So now the big question, should I be screened for pancreatic cancer? No test is 100% perfect in terms of what it detects. With colonoscopy, I could sit there and tell you how important it is for you to get your colonoscopy, because I know I could find a polyp and remove that polyp and lower your risk of getting colon cancer in that area of the colon, particularly in the left side of the colon that's been surveyed. And I know I make a difference, and I have lots of data and studies to show that. Same thing holds true with mammography. We know we can detect breast cancer in an early stage. I don't know that yet at this point in time, whether or not we have the ability to detect pancreatic cancer and really extend life, not just extend life by making the diagnosis sooner than what you would have expected it to see. So that would make it look like you're living a year longer from pancreatic cancer, but that may be because on the curve before you develop symptoms, I detected it a year earlier than it would have presented itself. So without that piece of knowledge, I can't, I think people just have to know that this may not be the holy grail of testing. So, we suggest endoscopic ultrasounds as our test because we think that's the best test for looking for subtle abnormalities in the pancreas. You only have a 50-50 chance of carrying that gene. So that's why if we can find the gene, it's nice to test, because we know that surveillance in these high-risk families gives us the best yield if we know that they have a gene that's abnormal and they carry that gene and are at risk for pancreatic cancer. So not everyone from hereditary breast ovarian cancer, these BRCA1 or 2 mutations that you may have heard about, if you have friends who have breast cancer or early age breast cancer, they don't need to be screened for pancreatic cancer because the risk is actually only about 3 to 4-fold. But if you have pancreatic cancer somewhere in your family, then you may have that predisposition of getting it. Then we think those patients should be surveyed. And we don't survey every family member, just those who carry the mutation. Typically it costs around $3,000. Is often covered by insurance to be tested for various genetic disorders. But once you find it in a family member, then the cost falls to about $200 or $300 because we know exactly where to look at. We don't have to look at the whole gene. We can look at where the mutation is in that one affected family member. We want the cure. We want to be able to cure and truly prevent the cancer. So with that, thank you.